we think that vagus nerve stimulation could be a really practical therapy for people who have post-traumatic stress disorder. And the way we would propose to do this is to use it as an adjunct to therapy, to rehabilitative therapy. So people who have post-traumatic stress disorder typically take drugs to treat their symptoms. Antidepressants are effective in treating the symptoms, but they simply treat the symptoms and not the underlying cause. So once the drugs are not taken, then the symptoms come back. So what we want to do is treat the underlying cause of the disorder. And the way therapists do that is to give patients exposure therapy. So for exposure therapy, a patient comes into the therapist's office, and if you take the combat veteran who has a panic attack when he hears the sound of a helicopter, for example, the therapist will play the sound of the helicopter over and over and over again to help this person learn that the sound of a helicopter is no longer something to be feared. And as we know, people who have PTSD are impaired in this. So it takes a lot of therapy, and it's a difficult therapy. It's trying for both the therapist and the patient. So it's a very effective therapy, but a lot of people don't volunteer for it because it's obviously not something somebody would look forward to. But we think we might be able to help by stimulating the vagus nerve at the time that they're going through this therapy. So they would get simultaneous vagus nerve stimulation while they're hearing the sound of a helicopter, for example, or it could even be done with virtual reality to make it a little bit more complex. But we think this might help people to extinguish better by not only enhancing the long-term memory, not only enhancing their ability to consolidate this new memory that I'm okay when I hear the sound of a helicopter, but also by helping them to feel okay. They're not having the heart palpitations, they're not having the sweaty palms, so it should be a little bit more pleasant